5.4 million.
5.4
yes.
million.
Yes.
That's quite a population. Why do you think this is happening in this day and age?
Okay, you know, mental illnesses by their very means have what we call social determinants that cause people to get ill. Let me give you the statistics. Number one, unemployment. A third of our population, live below the poverty line. That is less than $1 per day per family. Number two, unemployment. 40% of the youth population in this country is unemployed. We have the highest unemployment numbers in East Africa. That leads to a lot of depression and a lot of anxiety. Number three, we have gender-based violence issues, like is reported in the media from time to time. And this has been leading to a lot of acrimony in families, and that sustained friction causes the people involved to get mental health conditions. Number four, we have a lot of trauma that people are enduring because of the things like, let me mention the 2007-2008 post-election violence. Do you know that 62% of the displaced people during that period developed post-traumatic stress disorder? Gambling. I have said over and over again that we have a gambling epidemic in this republic, and the gambling operators have refused to assist their users because their users are going into depression because of the mounting debt that they accrue. And last and finally, we need not forget that we are living in the era of the COVID-19 pandemic. COVID-19 escalated mental health conditions to obscene numbers, and that is why we are seeing such a high prevalence of mental ill health amongst our population.
Now, in this population, 5.4 million is not a walk in the park. That's quite a population. Which demographic is highly affected when it comes to matters mental health?
When it comes to matters mental health, the youth between the ages of 15 and 25 are suffering the most.
Is it the same male, female, or because I remember when you brought up that issue of COVID-19, there was a survey that was carried out among the universities, and it showed there was a lot of gender-based violence, and most often we found that the perpetrators were rather male. Now they're rather, with a few numbers being female counterparts. So does this number still apply, or is it just general?
I should believe that the male population is more affected than the female population.
Now, talking about affecting, there's another issue that has cropped up, and it is all tied to matters of mental wellness. The high rate of suicide that we are witnessing in the country. Life is priceless, but now that's a price that a majority or significant number is willing to pay.
Suicide by its very nature, and we'd like to correct the media that we should be saying died by suicide.
Died by suicide.
Not committed suicide. It's not an act of commission. It is a result of distress. So the numbers we have at the ministry from a World Health Organization sponsored study is that we have 4 suicide deaths in Kenya on a daily basis, but they are underreported. Case being, suicide is a criminal offense. Number 2, there is a lot of stigma amongst families, so they will not want to confess that one of their own died by suicide. And I would like to let you know that as a division, we have really participated in a lot of advocacy so that we can decriminalize suicide. Suicide is not a crime. It is a mental health condition, so we should not arrest them. You know, if you are arrested for trying to commit suicide, it is a 2-year jail term, a fine, or both. So the Kenya Psychiatric Association, together with the Kenya National Human Rights Commission, and a very ardent advocate of mental health, who is a person with lived experience because she has suffered from bipolar for a long time and is a person or patient of mine, Charity Moturi, have a petition at the High Court right now to declare that Section 226 of the Penal Code, which is the one that criminalizes suicide, is declared unconstitutional.
This is the numbers of suicide?
No, there are multiple strategies that the ministry has embarked on to reduce the rate of suicides in the country. Number 1, we have launched the suicide prevention strategy just in the month of August. We celebrated the World Suicide Prevention Day on the 10th of September. In the suicide prevention strategy, we have collaborated with the Ministry of Agriculture, and one of our interventions is restricting access to the means of committing suicide. And this usually happens mostly through ingestion of pesticides. Number two is that the policy by the ministry aims to reduce deaths by suicide by 10% by the year 2026. It is a matter we are taking very seriously, and as we speak, capacity is being rolled over to the counties, like I said, because the document already exists. Now, implementing and seeing the results of any policy takes around 5 years for you to see real change after implementation.
We'll be keeping tabs on that. The earmarked year is actually 2026, so give or take, we have around 3 years to see that come to fruition. Now, on an individual level, away from matters of policy, from where you sit as a psychiatrist, what are the triggers? What triggers should someone be looking out for?
Okay. I am an ardent advocate for self-discovery and knowledge of thyself. So it is that you are aware when you go out of balance, when you are unhappy, when you start feeling sad. And signs of mental illness sometimes are very predictable. One could be somebody sleeping too much. Another could be somebody sleeping too little or not getting any sleep at all.
Insomnia?
Insomnia.
Okay.
There is eating too much. Another one could be not eating at all and lack of appetite. But anytime you feel that your mood is low and you are sad and you start questioning your self-esteem and you start feeling unworthy, and then your emotional and psychological state is that you are not enjoying things you used to enjoy. Biggest trigger, you find somebody not enjoying the things they previously enjoyed. If you loved watching movies, you no longer even get any peace from an activity that caused you happiness before. So self-knowledge, self-mastery is the key.
Now, Daktari, other than where do I seek help? Now that I've known I have a problem,
yes.
Supposing that I have a problem, where do I seek help?
We are, the numbers we have on capacity is that we have professionals being posted to every county to assist people who may be in need. As I speak right now, we have 52 psychiatrists in government service. We have 97 student psychiatrists at the University of Nairobi. We have another 20 university students who are doing their masters in psychiatry at the Moi Teaching and Referral Hospital University, Moi University. So we are in the process of increasing the capacity of professionals to assist people. That aside, we have 16 government health facilities that have inpatient services, 16. And the government always collaborates and synergizes efforts with the people in the faith-based organizations and private providers. And it is upon the patient or the person who feels like they need help to take care of their own initiative and look for the professionals because they are there. Furthermore, the Kenya Red Cross has done a very good thing. The Kenya Red Cross has an emergency toll-free line for anybody who is in distress. The number is 1199. If you call the number 1199 and for any reason you're in psychological distress, they offer what we call psychological first aid. You know, like when you get an injury, a regular physical injury, the first aid where you are cleaned out with an antiseptic or something like that to prevent it becoming worse. Now we have what we call psychological first aid. Yes, you get emotional first aid, and if you're in distress, at least we get to see that you live another day. Is
mental health services actually covered under the NHIF?
Very good question. I really feel that we as a division of mental health, led by my director, Dr. Simon Jogona, have been engaging the NHIF to increase their funding for covering mental health conditions. Let me surprise you. Do you know that if you're admitted in a level 4 facility in Kenya with a general medical condition, they pay 3,000 shillings for your bed every day? If you are admitted and the diagnosis just changes and they write a psychological or a psychiatric condition, they only pay 1,000 per day. There is a lot of what we call iniquity in means of coverage. Number two, If you are to access outpatient services for mental health under the NHIF, they only pay 1,400 shillings per person per year, which is not enough to cover the drugs, the psychological first aid, the counseling services after that, and aftercare. So we encourage Kenyans in the last talk to take NHIF cards to cover themselves, just in case they need to access mental health services.
Okay.
The current uptake of the NHIF is at 16%, but we are continuing to advocate for the NHIF to consider mental health to be like any other mental health, any other physical condition. Why are they discriminating against patients with mental illnesses? That is the question I want to ask them.
Good question. Now, we also want to ask you, tomorrow is the World Mental Health Day, and the theme is mental health in an unequal world. What should Kenyans expect? Okay,
in answering that question, I would expect that Kenyans realize that stigma and discrimination is one of the things that really stands in the way of patients with mental health conditions accessing care. So the inequality in mental health is because of the stigma. So we will be passing a message that mental health conditions are diseases like any other. Please do not stigmatize people with mental health conditions. And I'm happy that you have run a feature of a couple that got married the other day, and both of them have admitted openly that they have a mental health condition. So let us end stigma against mental health conditions.
Indeed. That has been our guest this evening, as we have been discussing matters of mental health and the impact it has on your quality of life. The number to share in the event that you find yourself in distress, or psychological distress, so to speak, is 1199. You're going to get first aid, and take home is that we shouldn't stigmatize anyone who finds themselves in this situation, given that the statistics as they are is 5.4 million of us Kenyans are suffering are suffering a mental disorder of